how has it been working in the sim lab, and how has it improved your clinical knowledge?
We did do our heart sounds last week. I think in Sunday and I were even talking about this just a little bit before this presentation this evening, but it's nice where instead of always being, textbook, looking at our computers, doing kind of the bookwork side where we can take what we're learning and actually apply it in real time. And so not to say that, when we do our simulation labs, yes, we have unreal people, that we're doing those on, but we also have real individuals that do come into what we'll say kind of our clinic. And so as we are learning things, we are getting to put that into practice on a weekly basis, which is really helpful so that you are being able to take what you're learning and then jump right into doing it on actual patients. And then we'll be able to see a lot of discrepancies or differences between people, since there are going to be a lot of things that we'll learn about, but there could be many different presentations when it comes to each of our patients. And so I think it's very beneficial and helpful also that we're getting the hands-on experience, because even as medicine is progressing, so many things with patients comes with just that doctor-patient relationship and having that comfortability and being able to progress in that way, which I think is a great way to combine our head knowledge, but then also our personal knowledge as well, being able to interact with our patients.
PCC is my favorite part of the curriculum because it's like, oh, I really feel like a doctor now. Like I'm working with patients or simulated patients and things like that. But then also to just kind of bring it back to like our curriculum, it allows you to like not get stuck on kind of what Carly was saying earlier, where the MBME questions ask you the whole process of things. So coming to the simulation or going to our skills or going to our interview with the patients, it forces you to not think about just what the quick answer is. You have to actually sit there and think like, okay, well, I know that I hear this or I know that I see this, but like, what is actually going on? Like, what's the pathophysiology behind what's going on? So it kind of allows you to test the knowledge or test the concept that you've been discussing in classes. Like, okay, now we're seeing it, and I don't want you to just tell me like what you see, but like explain to me based on what we discussed this week in class, what's going on with this. So it allows you to tie it in with that as well.